If you aren't using PRF in your practice yet, well, you're missing out. Did you know that through the use of PRF, we can actually accelerate healing of your surgical sites from everything from extractions to guided bone regeneration, soft tissue healing, and it can even be used to regrow hair. Now, we have to make PRF by taking our patient's blood through a super easy venipuncture procedure and then transferring the vacuette blood collection tubes to a centrifuge and spinning the blood at a certain angle and at a certain speed to make a cross-linked fibrin matrix. Inside this matrix are all the patient's growth factors and cytokines that call on other cells to lead to healing and angiogenesis or new blood vessel formation of the wounded area, thereby allowing quicker healing. And man, let me tell you, PRF makes such a huge difference in mandibular third molar surgery. Applying PRF to the site is so simple and easy, as you can see here. After I rinse the flap and I'm ready to close the site with the suture, I just place PRF right out of the tube and right into the socket. In the socket, I know that the PRF acts as a reservoir for the patient's own growth factors and leukocytes that will play a role in healing and supporting angiogenesis and immunity. This is why when we add PRF to third molar sites after we extract the tooth, studies have noted a 95% reduction in alveolar osteitis or dry socket. And this is huge. I very rarely see patients that experience a dry socket anymore. And just for this alone, PRF is worth it. Also, multiple studies have demonstrated a significant reduction in swelling and pain in patients in comparison to patients where, PRF was not incorporated into the sockets. And wow. Through the power of PRF and its associated growth factors, we can reduce pain, swelling, and the incidence of alveolar osteitis. I feel like I don't need to convince you any further. I highly encourage you to use and incorporate PRF into your surgical practices. You won't regret it.